have this acronym FAST: face, arm, and speech and balance. And if there's anything going wrong with those four, then that's a sign the brain is being deprived of oxygen. Now, the good thing about that is if we detect it, we can pass a fine catheter up the blood vessel and suck it out, a bit like we do with coronary arteries. And that has now come to the brain. And each capital city in this country has got one or two people who are skilled up to do that, who are sitting by 24/7, and that has made a marked difference in the outcome from what's called ischemic strokes, which used to be seriously impairing and often fatal. One of the things is, you may have heard of atrial fibrillation, whereby the heart goes into an abnormal fluttering type rhythm. And what happens there, the atria, they're the small vessels on top of the heart, start fluttering, and so blood clot can form in the atria. And then that blood gets into the left ventricle and goes up to the brain. So anybody who's in atrial fibrillation, and it's pretty evident when it happens because you get palpitations, either needs to be put back into a normal heart rhythm, which we can do with drugs or an electric shock, or if we can't, then they take a blood thinning agent that stops clots forming in their atria. And anybody in long-term atrial fibrillation is now on a blood thinner, and that makes the chance of stroke markedly less. The other thing, of course, is diet, making sure your cholesterol is controlled, because the cholesterol forms those aggregations in your blood vessels that get pulled off by blood flow and act as little bits of debris and block blood vessels. And then the third thing I mentioned is blood pressure control. Get your blood pressure checked, all right? You can't know what it is. There are no symptoms to simple hypertension, but if it's detected and treated, the outcome is really good, and they're pretty easy drugs to take.